English phonetics, vocal organs. In this video, I'm going to be talking about vocal organs, and I'm going to describe their function, their main roles, and how they produce the different sounds. The first thing that we have to know is about the lungs. The lungs are very important in the production of speech. They are the one in charge of producing the airstream that from the lungs passes between the vocal cords, which are two small muscular folds located in the larynx at the top of the windpipe. The role of the lungs is that of the initiator. They are the source of stream. They are not capable of movement themselves, but they get those movements thanks to the movement of the diaphragms and the swinging of the rib cage. They can be also egressive air and ingressive air. Egressive is when the air comes out of the mouth. Ingressive when the air moves inside of the mouth. Voicing consists of the sound being voiced or unvoiced. Then the muscular effort, for example, the muscular effort needed to drive the air out of the mouth, out of the body, substantial, is the fortis. And we can feel that movement. For example, an example of this is when we pronounce the voiceless sound pa, pa. We feel how we have to make a big effort to drive the air out of the body. And then lenis is the little muscular effort needed to drive the air out of the body. And we do that when we are pronouncing words that are phonemes that are voiced. They are voiced because our vocal cords, they vibrate, the vocal cords. The larynx is located, is the part of the vocal tract located that comes immediately on top of the trachea, the windpipe, and is coextensive with it. The larynx hold the vocal cords, also called the vocal folds, made of elastic tissue and capable of movement. The larynx also plays an important role in the initiation of the glottic airstream mechanism. The pharynx, the role of the pharynx is a resonance. It's like a resonance box. The shape of the vocal cords are like slatty tissues. They are joined at the front of the larynx at the level of Adam's apple, and are capable of movement horizontally. When the vocal cords are close to one another, then the sound that is produced is voiced because there is vibration. And when they are apart from one another, the sound that is produced is voiceless. In this case, they do not vibrate. An example of this is pa, when they do not vibrate, because it's a voiceless sound and they are apart. And when they are close to one another, might be the sound ba, because the sound vibrates. The roof of the mouth, we can see in the roof of the mouth, we have the soft palate, the hard palate of the velium, there is some air in the vocal cavity, but it's blocked at a given point of articulation. The only passage available for the air is the nose. In those cases, the articulation, we articulate the nasal sounds, nasal sounds. The velum can also be raised, belly closure. The nasal cavity is shut accordingly to the only outlet available is the mouth. The sound articulated this way are called oral sounds. Oral sounds. The velum also serves as a place of articulation in sounds like k, j. The velum also plays an important role in the initiation of the vellatic air strength mechanism. The hard palate, since it is not capable of movement, is mainly is mainly a place of articulation. Vellarization, secondary articulation in the pronunciation of consonant in which the tongue is drawn far up and back in the mouth toward the velum or subpalate as if to pronounce vowels such as O or U. Name the parts of the tongue. The parts of the tongue we have here the blade, the tip, front, the back of the tongue, and then the tongue is generally divided into parts for the sake of the phonetic description. These parts are identified on the basis of their position with respect to the roof of the mouth, the back, or velum, the blade, or hard palate, the tip, or the alveolar ridge. In vowels, the tongue can be raised to various levels. The difference between the vowels E and A is one tone high. Different parts of the tongue may be responsible for the articulation of vowel sounds. The difference between the vowels E and U is based on the part of the tongue involved, the back in U and the front in E. Tongue action in consonants. Different parts of the tongue are involved in consonant in the sounds T. The tip of the tongue is used and the sounds N. However, it's the back of the tongue which is involved. The tongue can also assume various positions. One special case is the curling of the tongue backwards so that its underside faces the roof of the mouth. This is the case of the retroflex sounds are the lips. The lips can be spread, rounded, or neuter. What matters in speech sound articulation is whether the lips are rounded or unrounded. Lip rounding. Vowels, they can be distinguished on the basis of lip rounding. The vowel A and the vowel A. The vowel A and the vowel A are identical in every respect except the lip rounding. Consonant. Lip rounding is involved in labialized consonants like H. Labiodentalization. The lower lip is involved in labiodental consonant like V. The T is a place of articulation. The teeth interact with the tongue in dental sound, like in T, D, T, D. The teeth also interact with the tongue in interdental sound, sound in which the tongue tip is protruded between the upper and lower teeth. The teeth also participate in displaced articulation, like labiodentalization, in which case the lower lip is made to move backwards or to interact with the upper teeth. So in this case, the point of articulation can be bilabial, and it depends on the points or articulation that are used to pronounce those phonemes. Labiodental, dental and interdental, postalveolar, retroflex, palatoalveolar, palatal, velar, uvular, pharyngeal. It all depends on the place of the point or articulation that are being used. Thank you for watching.